The NHLBI is pursuing a research agenda that engages communities, patients, researchers that are pursuing implementation science that will provide a link between interventions that will have a positive impact on their communities and address health inequities. At our institute, we believe an important approach to addressing health inequities involves the area of prevention and prevention services. For example, we funded a study that recognized that barbershops are an important place of convening and communication and information sharing in certain communities. And the investigators were able to leverage that community resource to promote health and prevention services related to hypertension. And it showed a key benefit to that community. Our institute is committed to ensuring that our research has a direct impact on the health of the nation and the health of everyone in every community. So it's really important that we engage communities to ensure that each individual feels empowered and that the community really is a partner with us as we promote research that develops innovative strategies to really improve an individual's health and the health of their overall community. We hope that as part of our research efforts, we can develop best practices and models that empower people to take control of their health and to act on knowledge in ways that improves health outcomes. We now have the capability of connecting with health and promoting prevention that goes well beyond the clinic walls and permeates all the way to communities. We have a way of now connecting people together, patients together, groups together with flows of information that could be channeled and personalized in ways that are unprecedented. All of these tools and technologies can now be used to extend preventive services in ways we couldn't have imagined before. This is an opportunity to really democratize information and to provide it and put it in the hands and empower people and patients and communities. We think this could be incredibly transformative in addressing health inequities, as again, we involve and engage community to work together toward improving their health.